Alright, so this is my second video for my Clinical Pathology 2 class. My course number is BTHT2331-33430. My name is Heather Lieberman and my student ID number is 3309588. In this video I will be doing a fungal culture, a vaginal cytology, a necropsy, and a manual blood cross match. So let's get started. Hi, Heather Lieberman here. In this portion of the video, I'm going to be demonstrating collecting a fungal culture. So there's a couple different ways that you can go about doing it. One is using a pair of sterile hemostats. Another would be using a new toothbrush, where you would kind of abrade the area with the toothbrush. Today I'm going to be demonstrating with the hemostat. What you're looking for, how a normal fungal infection would present, is a hairless, like round lesion. There can be some crusting in that area typically as well. So Vader here, we're going to use his back foot. He does have a couple lesions there, so we're going to do a test on him. I am going to briefly just kind of cleanse that area. What we want to do is we want to collect from the periphery or the outside area of the lesions. That is where the dermaphytes tend to be more active as they start in the center of the lesion and work their way out. They do kind of live on the hair shafts of the lesions or in that area, so that's why we want to collect some of that hair. We're going to then take that and place that into this. So this is dermaphyte test medium, and what this does is it turns red if it is a true fungal or mycotic organism that is growing. So what we'll do is we'll get started here. I'm going to just gently kind of cleanse that area, nothing crazy, because I don't want to completely remove some of that. And then I'm going to open my sterile hemostats here. And I'm also just going to prep my bottle or my vial so that is ready for me. Okay, so I'm going to come to that area, and again, I want to go to the outside, so I'm just going to take some of that, and like I said, those organisms live on that hair shaft. And I'm hopefully taking or removed all the contaminants with that gentle cleanse I did. And then I just want to lightly push that into the test medium, not too deep, but just enough to kind of root it in there. And what I'm going to do is I'm going to leave that then at about room temperature. I want to leave my cap a little bit loose. I don't want to completely close that off. And then we're going to watch it grow over the next few days. Once we see some color change or some growth, we'll start testing it with strips of tape and go from there. Alright, so we'll check back in a couple days. Alright, so today we're going to finish up my fungal culture assay here. So stuff that I'm going to need, I did cut a couple strips of some cellophane packing tape here. I got those ready for me because those could be a bit of a challenge to cut. My book requires a lactophenol cotton blue stain. Here in our hospital we have some methylene blue stain that we use for our fungal culture readings, so that's what I'm going to be using today. Some hemostats for helping me hold my tape and the slide. It has been a couple weeks since I started my fungal culture. I've had no change in my medium, so that's kind of leading me to believe that we don't have any kind of fungal infection going on here. There is a little bit of a kind of hairy like growth on the hairs there, but that could very well be contaminant. So we're going to take a look at it microscopically today. So I'm going to open it up all the way and get myself prepared here. So I got my little tape. And I'm just going to kind of get a little bit of that sample and then have it adhere down onto my tape. So just kind of dabbing it in there. And then I'm going to bring her out. and I set it on my slide here. I know it's all kind of invisible. And then I have my stain. And I'm just going to put one little drop on the side here, and it kind of vacuums itself under my tape, or that's how it's supposed to work. So just going to kind of let that drip down. I got a little, I want to cover it. There we go. We're getting good coverage here. Alright, so I'm going to come on over to my microscope here. Things I'm looking for would be the hyphae, the fruiting bodies or fruiting heads, and just it depends on what kind of fungus I'm looking at. So if I am seeing anything, I'm going to be able to differentiate based on like the body shape, size, how many cell divisions there are in there, and then I could be able to decipher, oh, this is Microsporum canis, this is Microsporum gypsum, which are like the two more common fungal infections we'll see in the veterinary field in small practice. So we'll take a look here and see what we got. Starting here on low power. Glasses in my way. So I got a nice view here. I'm just going to flip on over to high power. Start looking. So looking at this, around, I have like a nice hair kind of right in view here. I do see like some what look like hyphae structures in here. I'm not seeing any fruiting bodies. And again, I'm also already kind of suspicious of it being negative based on the DTM or the dermatophyte test medium not changing to a red color as it typically would. I can even flip on over to high power and just take a look there, although I should be able to see it. Yeah, I'm not getting anything special out of this. So based on what I'm seeing through these fields, I would say that the fungal test was negative for anything. So that's my results for this. Hi, so now we are moving on to the necropsy portion of my video. I got my preceptor, Dr. Napawaki, here today, who's going to be helping me. So the reason that we're doing a necropsy, or why you would want to do a necropsy, is a couple different reasons. One would be to evaluate like the disease process or processes that could be going on in that animal. Coolly enough, using that information to better other animals' health that could be suffering with the same thing, and also finding the cause of death potentially, which could bring peace to certain pet owners, at a time of loss. So we're gonna kind of look over here at all of our instruments or tools that we're gonna need. So we have a basic surgical pack here. Has all of our instruments that we'll be needing except for a biopsy punch, which we have laid out here. We have our scalpel blade. And then over here I have a couple biopsy jars that have pre-measured formalin already in them, and my little Sharpie for labeling. Both Dr. Napawaki and myself are all gowned up in our PPE, so we have our gloves, cap, mask, and our gowns on. So I think we're kind of ready to start rolling.
Here's our patient today. It's a small white rat. He has been preserved in the freezer, so some of our findings might reflect the fact that he's been in the freezer. First step is we're going to look at the little guy from the outside and see if we can find any abnormalities. This rat has a torn ear. Some kind of trauma was likely there. He also has a little bit of brownish bloody discharge from his left nostril, and his left eye appears to be abnormal also. Other than that, he's in good body condition, just the right amount of muscle and fat. So now we'll start our internal examination. So we're going to start with the number 15 blade and make a midline incision all the way down the middle of this rat's belly from his xiphoid to his pubis. Okay, where we have a skin incision. And below that we see the muscle layer. Okay, now we'll enter the body cavity. Okay, so doing the abdomen first. Okay. Alright, there is our rat's belly. And then we're going to open up the thorax.
So cute and tiny.
Alright, this is a tiny little guy. Okay, so first we're going to inspect the thoracic and abdominal cavity for any obvious abnormalities. This rat has free blood in his chest. His lungs are deflated. Extend that incision a little bit. Okay, and we can identify his heart, some lung tissue. There's his liver. Palpate his stomach. And then we're going to take some samples of these tissues. There's his spleen. This rat's intestines are very soft and fluidy.
I'm putting on the floor now.
Okay, we've got a kidney. And the other kidney. Okay, let's get some samples.
Alright, let's do it. Okay. Jar ready?
Stomach. Okay. Let's see. This is a sample of liver.
Okay, and I'm gonna,
check that.
yep, I'm gonna get this all wrapped up
All
here.
right.
So I'm gonna label that. I will name him Mr. Rat here, so that'll be under his name. We're gonna mark that it's liver, and it does have a spot for the date, so I'm gonna put that on there. Okay, so that's our first sample. I'm gonna move forward with the next one.
Let's use the biopsy punch.
I like it. What should we biopsy? Or what should we punch out here? I should say. Yeah.
Right through the renal cortex. Due to the length that this patient has been deceased, a lot of our tissues are very soft. So the biopsy punch opened our tissue, and I'll collect it this way.
Trying to avoid any splashing or touching of our formalin while transferring our samples. Closing them nice and tight. And I will put Mr. Rat again. Renal. And that was his left kidney. Okay. Alright, so that's how I'd be going about labeling it, while Dr. Knapp would kind of be going through doing her exam. You know, like she's been very well evaluating all of the different parts of the body as we go through. And that would be the gist of doing a necropsy. Alright, so in this video, I'm going to be demonstrating collecting a vaginal cytology. Reasoning behind doing this would be tracking where we're at during the estrus cycle. And this would be helpful for breeding dogs in breeding programs, or if we were planning to artificially inseminate a dog. This is Tina. Tina's 4 years old. She has had some puppies in her past, and today she is getting spayed. But we're going to do a vaginal cytology on her. So I'll have my camera woman come on over here. So this is the supplies I'm using. I have a little bit of chlorhexidine scrub. I drew up some sterile saline from here, which I'm going to use to moisten my sterile Q-tip. So let's get things kind of started here. Okay, so I'm going to moisten my Q-tip by just adding a little drop of this to it. A couple drops. Okay. Set that back down. I'm also going to do a quick little cleanse of her vulvar area. Sorry, girlfriend, a little cold. Okay. How's it going back there? All good? Just to wipe away any contaminants from that area. Okay, so now I'm going to kind of hold up the lips. I'm going to insert my cotton tip dorsally and then horizontally. So we're going to go in and in. Do a little bit of a swish. Okay, and that's my sample. I do have a couple slides over here, which I will take. Don't laugh, I gotta get my hair done. And just put my sample on here. I got two, so I might as well just in case. And we'll take this into the lab and get this stained and read it. Alright, so now to the next portion. I'm going to start staining my slide here. I'm going to put it in my fixative first. I'm doing a Romanowski type dip quick stain for this slide, and then touching base on what I'm looking at here and what could be going on with the female during the different stages of estrus. So during an estrus, that is when we would see no vulvar swelling. She wouldn't be attracting any males, and the cell types would be predominantly parabasal or non-cornified cells. Okay, then we would get into proestrus. During that time, there would be some vulvar swelling. She would have some red discharge from her vulva, and she would attract males but not accept them. And during that time, we start to see a transition from the parabasal cells to intermediate cells. So we actually see at the kind of, I guess you could call the beginning, we're starting out with non-cornified. As the estrus cycle goes on, they cornify, and then they again end with becoming non-cornified. The next part of the stage would be estrus. That we would see some straw-like colored discharge. She would still have her vulvar swelling, and at that time she would be accepting males. So in the proestrus part, when the cells are kind of the previous stage, the cells are transitioning from that parabasal non-cornified to cornified, we would also be seeing red blood cells during that time. So those start to go away during the estrus part of the cycle. Again, like I said, that's when she would be accepting males, and that is when we would kind of consider her in heat. And then at that point, after we transition into metastrus or diestrus, you could call it as well. And during that time, those cornified cells begin to transition back into the non-cornified state. So we're going to start out with the parabasal cells, start out with the superficial cells, and then end out with parabasal cells. I'm going to flip on over into my next stain here. This one I don't need to leave it in as long. We're going to do about 30 seconds for each. My red stain, which is my hyacinth stain, and then we're going to go into my methylene blue stain. Okay, so we'll switch on over to there. So that was kind of just a once over on the different stages throughout the estrus cycle. And during that last diestrus or metastrus stage, the female's vulva would start to not be as swollen. So the swelling would decrease, and she no longer would attract males anymore during that time too. So just some internal or cellular things we would notice, as well as external things that we would notice during the different stages. Okay, so flipping on over into my methylene blue. And then I will be rinsing my slide and letting it dry really quickly, and then we'll take a look at it. Another thing to kind of incorporate with your slides when you're looking at them is history. So, when was their last heat cycle? Again, what symptoms or signs are they showing externally? Are they attracting males? What color is their discharge from their vulva, if any, at that time? To kind of incorporate with what you're seeing under the microscope to give you the best results for your doctor. Okay, so here we go. We're gonna give her a little rinse. Okay, just gonna let this dry real quick. So we are, like most of the time when you're looking at the microscope, start on our low power, then we'll go over to high power, and then we are going to switch over to oil to finish when we're looking at it. So I'm just going to dry my slide here. Don't want it to be too wet, as it kind of has a little artifact appearance when you're looking at it on the slide. As I'm kind of just tapping this off here, I'm going to get kind of positioned. So unfortunately for Tina, who I'm doing this on today, we don't have a history of when her last heat cycle is. We do know that she was from a puppy mill, so she has had multiple births, in the past, delivered a few, but the new owners aren't sure when her last heat cycle is. So unfortunately, we don't have that information to incorporate in what I'm reading here to use to our advantage with everything. So here we go. Starting with getting it into focus here, switching on over. Okay. Already noticing some of my cell types there, looking like some parabasal cells, as well as some intermediate cells. So now I'm switching on over to oil. So far what I'm seeing are non-cornified cells. And I'm just going to start flipping through some of these slides here, or some of these views. So here's a good view here of a bunch of parabasal cells, 8, and that is about it as far as what I'm seeing. Again, some more parabasal cell. Couple intermediate cells here. Flipping through a few more slides here. Again, more parabasal cells, got that nice round look to them, big round nucleus in there. Just flipping through. So based on what I'm seeing on here, with the predominance of her parabasal cells, I would say that she is an anestrus. But again, ideally we would like to have, you know, background information of when that last heat cycle was, and we would be repeating these normally every few days if it were in heat cycle, just to kind of keep track. So if I were to suspect her being in heat, we would be doing this daily, you know, to just kind of see where she's at, and then we would use that information to know if it was time to breed her or not. So that is my demonstration for a vaginal cytology. Alright, so today we're going to be doing a manual cross-matching test. So some of the supplies that I'm going to need are some sodium chloride. I have some plain top tubes, which I already have a skew of them set up, some pipettes, some syringes. I got my Sharpie here just to help with labeling. So I kind of already started some things prior to, just to save us some time for the video's sake. But basically what I have going on here is I have my donor cells, or donor blood, and my recipient blood. So doing this cross match is going to help me decide that the patient who would be the recipient, who would be in need of a blood transfusion, if he can accept the potential donor's blood here. So that is why we would want to be doing this test. What I did is I had a lavender top tube and a red top tube, which actually this was my red top tube. I just saved it for kind of evidence here that I separated the serum off into here. So I got Dozer, my donor, and this is his serum. So I will be using that as part of the test. This is kind of just to show that I had done that. This is my packed red blood cells, and this is the plasma that I had pulled off of there. So this is for my donor, and then I did the same for my recipient. So again, let's see here. This was my serum separator tube, which I pulled his serum off of. And then this was his purple top tube, which I pulled his plasma off of. Okay, so I got that set up, and now what we're going to do is do a red blood cell wash, basically. So what I have is, or what I need to do is put a couple drops, and by couple I mean 2 drops of blood from the packed red blood cells into my tubes. And then I'm going to fill the rest of it up with some saline. So I got my thing here. I'm going to take a couple drops of my donors, and I do have this labeled Dozer Donor RBC Wash, just so I don't get them confused. So I got some here. I'm going to do 2 drops of blood. 1, 2. And I'll dispose of that in a second. Alright, and then over here I got my recipient with my recipient red blood cells. And get 2 drops of that. 1, 2. Okay, put that to the side here. Alright, now I'm going to get some saline. These are smaller tubes, so I'm going to fill them up to their little measuring lines here on the side. As an indicator of where I need to fill to. It's about 3 mLs. I'm just going to fill this guy up. Alright, drop a little bit more for my other one. And then I'm going to be, sorry, I'm paying attention and talking at the same time. I'm going to be spinning these at 3,500 RPMs for 1 minute. And I'm going to be doing this whole process 3 times. I will only be demonstrating this first time here in my video, so I'm just kind of giving them a little mix here, inverting them gently. We're going to go over to my centrifuge. I'm going to balance them out, and then I'm going to kind of adjust this. It's the wrong way. Okay? And we're doing 1 minute. Oh, I was 34. Okay. Oh, nope. Went too far. Okay, we're going to set that for 1 minute. And then I'm going to repeat this 3 times and we'll be back with the end result. Alright, so I ran that through 3 times. What I didn't mention before is between each time what I did is I did clear the supernatant off of these and then refilled with new saline. So this is kind of my end result. Got a nice clear supernatant there. So I am going to pour that off and then we're going to head back over to the workstation here. So I'll just dump that off. And this is kind of like what I did each time in between. And next what I'm going to do is make my final wash, we call it, I guess, is a mix of 0.2 ml of my washed red blood cells to 0.98 ml of saline to make a total of 1 whole ml. So what I'm going to do here is start with drawing that up. Little air bubbles. Okay, so I got my 0.98 of my saline we'll start with my donor final wash here. So I'm going to add that to his tube. And then I'm going to just take 0.02 of an ml of my packed red blood cells. Okay, put that aside here. And then I'm going to do the same with my recipient. So get my tube ready here. I'm going to use a fresh syringe and drop 0.98. Okay. Add that in, and then my 0.02 of my red blood cells. I got an air bubble in there. Yes, we do. We do. There we go. We're getting there. Okay, and then I'm going to add that into this tube. Just holding them. Okay. Okay, let's clean up my mess a little bit, get organized here. So now, with these washes and our serums, we're going to start like the actual part of our cross-matching here. So what we want to do is we're going to have a major cross match. That is where we're actually testing to see if there's antibodies in the recipient's serum when we're mixing it with the donor's red blood cells. The minor cross match is where we're mixing the donor's serum to see if they have antibodies against the recipient's red blood cells. And then we're going to do controls for both, where we mix the donor's serum with the donor's red blood cells and the recipient's serum with the recipient's red blood cells, to make sure, as like our controls, to make sure there's no issues and everything runs smoothly. Because for it to be a proper match, we don't want to find any agglutination or clumping of these cells, so those shouldn't be seen in either of our controls. Alright, so kind of helps me to get things labeled and organized here. So these are my washes. I'm just going to put those over here. So Charlie is my recipient, Dozer is my donor. We are going to do our major over here. We're going to do our minor over here. And I have, let's see, my minor again is going to be my donor's serum to my recipient's RBCs. That's going in here. We got major, which is again my recipient's serum to my donor's RBCs. And this is going to be my donor control. And this is my recipient control. Okay. So now we get to do some mixing here. So let's start here. So with our donor control, like I said, we're going to be mixing both the 2 drops of each. So 2 drops of the serum. 1, 2. Wrong cap, that goes there. 2 drops, oh, not that. 2 drops of my final wash. One, 2. Okay. So that is my first donor control. Alright. And now we're going to do our major, which is my recipient's serum. Right here. Get some of those air bubbles. Okay. 1, 2. And that is going to be my recipient's serum to my donor's red blood cell wash. And I should have just had pipettes for each thing, but oh well, here we go. So 2 of these. 1, 2. Alright. We're getting there, we're getting there. Halfway. Okay, and now we're doing our minor. So this is going to be, again, our donor serum to our recipient's wash. Right here. Which one is it now? Final wash. Here we go. Like a little scientist over here with all these tubes. Okay. So, 1, 2 of my donors. And final wash, 2 of these. Okay. And then finally, last mix is going to be my recipient's, which is my recipient's serum to his blood cell wash. So we're going to do 2 of the blood cell wash. And what I'm going to do is let this incubate for 30 minutes. 2. And then we will be back. We'll spin it down, and then I will look at them. We'll be kind of looking for any agglutination, which macroscopically or visually, I'll be looking for some hemolysis. and then we'll look at it microscopically. Okay, so I got all my controls, my major and my minor, all gonna sit for a half hour and we'll be back. All right, so we waited our 30 minutes to let the tubes incubate, and then I spun them down again at 3,400 RPMs for 1 minute, just to save time and avoid talking about it and starting the video all over. Now I can't apparently open our centrifuge, so hold on a second. Being impatient.
Oh, there we go.
There we go. Alright, so here are all our tubes. I'm going to carefully bring them on over to my little rack over here. We'll take a look at what we got going on. Okay, so let me separate out. Here's our minor. Okay. So here we have our major. Looking at that, things look pretty good. I'm going to just give it a little flick. So I'm looking for hemolysis by doing this right now, just to see, you know, macroscopically or visibly if there's any agglutination. So this is my recipient control. No hemolysis.
It doesn't say it. I always tell them.
Donor control, no hemolysis. So for these ones, my major, I am seeing a little bit of hemolysis there. But we're going to take a look at these microscopically. So we'll head on over to our microscope and make some slides here. Alright, so we're going to take, we're going to take a look here at our major. So I'm going to just take a bit of that sample, put a drop of it on my slide over here. And I'm going to get a cover slip. Alright, and let's see what we got going on. So I'm looking for agglutination of the cells, which they're kind of would be clumped into clusters. And I would be trying to avoid confusing that with rouleau, which is more like jacks and coins. So there is some clumping going on, and again, this is my major cross match here. So normally they do recommend rating this. I would say this would probably be about a 2+. It's not like everything is completely clumped together, but there are some parts where there are some decent clumping of the blood cells in here. So that's what I would rate it, is about a 2+ agglutination on this one. So I'm going to put that aside. We'll do one on my minor, and then we'll do one on our control just to demonstrate that, but I'm trying not to keep this video going too long for you guys. So that's control. So here's our minor. This real quick for you. So with my minor, I'm not having quite as much clumping. There is a lot more dispersedness between the cells, but there are some clumping going on. So I would still rate this as like a 1+ to 2+ on this. Probably more of a 1+, honestly. Not too bad of clumping, but there is some in there. All right, and then we'll just do one control just to kind of compare. And obviously in this we would want there to be no clumping, because there shouldn't be, since this is all, and we're going to do this on the recipient spool. So one drop on here. Alright, put my cover slip on. Perfect. start down here on low power, so we'll do that. Got it, okay. Perfect, okay, and wrapping up here, so there's no agglutination. All of the cells are nice and floating, not clumping together, so no agglutination there, and that was my control. So that was my demonstration of a manual cross match. Hope you enjoyed it. Thanks.